My name is Marsha Williams. Welcome and thank you for joining today's session. I'm with the NHSN Protocol and Training team and will be guiding you through this overview. Today, we will introduce the new Healthcare Preparedness Component, or HPC for short, within the NHSN application, and also provide information on the Daily Facility Operating Status module within this component. By the end of this presentation, you will be able to understand the purpose of the Healthcare Preparedness Component, as well as explain the Daily Facility Operating Status module, DFOS for short, as well as describe the reporting expectations for the Daily Facility Operating Status module. On July 24, 2025, NHSN will officially launch a new component, the Healthcare Preparedness Component, or HPC. If you look at the diagram above, you'll see the various NHSN components. Over to the far right, you'll notice the newest edition, HPC. This component is designed to collect actionable data on hospital readiness, operational capacity, and critical infrastructure status. To start, the first active module within the new Healthcare Preparedness Component is called the Daily Facility Operating Status module. So let us proceed to describe what the Daily Facility Operating Status module is within this component. DFOS is a new reporting tool that allows hospitals to monitor and report the status of critical infrastructure, both physical and operational, such as power, water supply, and structural integrity. This tool captures a standardized set of essential data elements that reflect how facilities are functioning, whether during normal operations or in the midst of an emergency. By reporting using this module, hospitals will contribute to a shared, near real-time picture of system functionality. The information reported will support near real-time situational awareness, informing local, state, and federal response and recovery efforts. I want to switch gear briefly to talk about what are the reporting expectations for the Daily Facility Operating Status. The DFOS reporting is optional and is only available at this time to acute care and short-term stay hospitals. Each hospital must report separately, even if they share a CMS certification number. Additionally, there is no need to include the DFOS in your facility's NHSN monthly reporting plan. I will now speak to the cadence of reporting and how the data will be entered. Reporting for the Daily Facility Operating Status is conducted every 12 hours, regardless of whether a facility is operating at its baseline normal operations or actively working through an emergency event. This cadence allows for near real-time data collection for consistent situational awareness. The data entry for the Daily Facility Operating Status module is manual, and at this time is not supported by CDA or CSV upload. It is important to note that input may be required from various departments, including safety, facility operations, and/or emergency management to complete this module. Lastly, the Daily Facility Operating Status module does not replace any mandated reporting. We encourage facilities to follow their local and state guidelines. The next series of slides would highlight the data categories that are included in this module. Listed here on the screen are the data categories for the Daily Facility Operating Status. We're pleased to share that these categories were informed by previous stakeholder engagement via a series of listening sessions. The daily facility operating status module will collect approximately 22 data elements across the 8 categories noted here. The 8 categories are as follows: facility information and date field. This will include the NHSN assigned daily facility ID and the month year of the report. The facility operational status indicator will capture the facility's current ability to provide care. Data will also be asked for structural damage, evacuation and re-entry, generator power status, which will collect data on the source and status of electrical power, including backup system, water and sewer system functionality. And lastly, there will be a section on immediate needs. This will be a free text field to report urgent needs that may affect patient care. These categories are designed to give a comprehensive snapshot of operational capacity at the facility level. The next series of slides will provide a glimpse of what the healthcare preparedness component and the daily facility operating status module looks like within the NHSN application. Once you have logged into the NHSN application, presented on the screen is the daily facility operating status user interface. You will see on the left, in the upper left-hand corner, the healthcare preparedness component in red. And below that, on the left navigation bar, you'll see in a blue square the facility operating status. Once the user clicks on the facility operating status, on the right, a calendar view will open up. This is the summary view. It will have the month and the year, the latest record, the date of the latest record entered, and it will indicate also the status of the facility. Users will have the option to select add to add a new record, edit to edit an existing record, and also have the ability to view prior data submitted by clicking on the History tab. The next slide will depict what the form will look like on the facility clicks on the opportunity to add and enter new information. Once the user logs into the application and decides to enter information regarding the daily facility operating status, a status indicator, facility operational status, will appear as shown here on the screen. The facility will have the option to select at this time normal, not impacted, contingency, partially impacted, or emergency, fully impacted. Based on the option selected, the user will continue to complete all required fields. Please note that a training webinar with more comprehensive detail on how to complete this module will be provided. Now let's take a look at a scenario so we could illustrate how the daily facility operating status form module can be used. The scenario presented here is a Category 3 hurricane passes through the region, knocking out commercial power lines and causes damage to the water treatment plant, leading to unreliable water supply. In this case, the user logs into the application and indicates facility operational status as emergency state. Facility operations fully impacted here, noted in red. The user then proceeds to complete the essential elements of information or the data categories that align with the 8 that were presented earlier. The user reports on structural damage, evacuation status, generator power status, water system, and immediate needs. Before we conclude, wanted to share that the daily facility operating status main purpose is to provide hospitals with a streamlined way to report operational status on a core set of essential data elements, offering a snapshot of tracking functionality to guide public health response and support patient safety. In summary, as we conclude, the Daily Facility Operating Status is a new voluntary module within NHSN geared to track hospital daily operating status, including both physical and critical infrastructure. Reporting for facilities will begin on July 24th, 2025. The reporting for this module will occur every 12 hours, both during normal operations and during an event, to inform emergency response and recovery. Lastly, the collected data supports situational awareness and healthcare system resilience. I want to take a pause to do a quick knowledge check. As shown here on the screen, what is the primary purpose of the Daily Facility Operational Status module? Is it A, to replace all existing emergency reporting system? B, to monitor healthcare staff performance during crises? C, to support situational awareness and emergency response? Or D, to track billing and financial operations of hospital? I see quite a bit of C coming in. Thank you everyone for participating. That is correct. The correct answer is C, to support situational awareness and emergency response. The rationale is that the Daily Facility Operating Status module is designed to collect and provide timely, relevant data that can help healthcare facilities, public health authorities, and emergency response teams monitor and respond to emerging public health threats or emergency. By facilitating the rapid sharing and analysis of critical information, this module enhances the ability to make informed decisions, allocate resources effectively, and coordinate actions during public health events or crises. We have one more knowledge check for you. Here on the screen, which of the following statements about the Daily Facility Operating Status reporting is true? Is it A, participation is mandatory for all NHSN facilities? B, the Daily Facility Operating Status data must be submitted weekly? Or C, hospital report individually even if they share a CCN? Or D, an NHSN reporting plan is required to participate in the Daily Facility Operating Status module? I do see quite a bit of C coming in, and that's correct. The correct answer is C, hospital report individually, even if they share a CCN. And the rationale is that the Daily Facility Operating Status module is designed to collect data at the facility level to ensure accurate and specific situational awareness and emergency response information. Individual reporting allows for more precise tracking of resources, capacity, and needs at each hospital, which is essential for effective public health monitoring and response. Sharing a CCN does not change the requirement for each hospital to submit data through the Daily Facility Operating Status module. Thank you again for your time. This concludes the presentation. And if you have any questions, noted on the screens are the links.